Welcome everyone to Code Calm, the podcast that offers leaders strategies to address stress and get a code for calm as they navigate life and work struggles. It is my good pleasure today to have as my guest Keeley Hayes, a Chief Nursing Officer, Vice President of Nursing for a large flagship hospital in one of the largest health systems in the United States. Keeley Hayes, welcome to Code Calm.
And thank you for having me, Dr. Gray.
It's such a pleasure. Now, before we get started, Keeley, can you just share with our listeners your career path? How did you get to be a chief nurse?
Well, Dr. Gray, so I'm in Milwaukee, Wisconsin right now, but I started my career in St. Louis, Missouri. I worked for SSM Health, and I had the typical career trajectory as most nurse leaders. So I started as a staff nurse, grew as a charge nurse, a nurse manager, a director of nursing. And my last role in St. Louis, Missouri, I was an administrative director of nursing operations. And in that role, it really positions you well for the chief nurse role. And along the way, I had some amazing mentors that took an interest in me. And at the time, I was in the C-suite as the ADNO and working very closely with a vice president of operations who relocated to Milwaukee, reached out to me and asked if I would be interested in a chief nurse position here in Milwaukee. And I relocated here for my very first CNO position, and that's how I ended up here.
Well, I love that you mentioned that you were that someone brought you along with them.
Yes.
So you obviously had developed skills in navigating stress, in meeting strategic metrics to a level that a leader who was relocating said, I want you to come with me. So tell me, earlier in your career, what did you learn to navigate well related to stress that you can share with our aspiring leaders?
Well, I think first of all, one of the most significant stressors that I have to manage as a chief nurse is delivering on strategic outcomes, especially when you think about the scope of work at a large quaternary hospital like the one that I work in. When you're in a large quaternary hospital like mine, your outcomes matter most because the enterprise is relying on you to carry a lot of the weight. And so, the stressors are real. And I've learned that you have to get work done through others. So you must lead through influence because you're not doing the work, even though you are fully responsible for the outcome. So learning how to get work done through others is essential. And you can't get work done through others unless you know how to lead. And I think that's why we're here to talk about the strategies for leading and
Yes.
managing through the stress of leading. And where I am right now, we have 2,000 nurses that get that work done.
Wow.
And so leading through that number and influencing that number of essential workers is a significant amount of stress. But we managed to get that done.
So was that a skill learning to, I know that you're really smart because you are where you are, but I think you learned some things. So if you were to go back to your supervisor self or your manager self, what would you tell them about how to learn to lead with influence that you can give us now, help some new leaders, aspiring leaders today?
Hmm. I think what I appreciate learning along the way and leading through influence, what I've learned along the way and appreciate most is how I relate to people and the relationship building that I've learned. When people know that they're valued, they connect to, especially nurses, they connect to their practice and they take pride in what they do. And they want to do the work because they're connecting to their patients and they're connecting to their practice and they're taking pride in the outcomes that they produce. And they they can't do that unless they feel valued. And I mean genuinely valued. And they're told thank you. And they're told I appreciate you. And it's more than just the words that are coming from your lips, that it's shown through the actions that you share. And I'll give you a good example of that.
Thank you.
So very recently in the city, we had a snowstorm on a Monday morning, and we had lots of people call into work. But we also had over 600 patients in the hospital that needed care at the bedside. And I don't boast on myself. I only do the right thing. And the right thing to do was to walk around this hospital to every department and tell them, thank you for coming to work today. And I know that it wasn't easy for you to get here, but I appreciate that you made the effort. And the response that I got just by saying thank you, I didn't have a treat cart, I didn't have Snicker bars, I didn't have potato chips. I had nurses saying, oh my gosh, it's about time.
Wow.
That someone said thank you. That's all they wanted. That's
Wow.
how you make people feel valued and connected to the work that they do.
I appreciate that because I always say that kindness is free and we should give it liberally.
I agree with
Because
that.
people don't believe necessarily come to work because of money. They come because of the relationships that they
Mhm.
have and that they value. So you have people, how do you help your other leaders, your directors, managers embrace the same type of commitment to kindness that you do to reduce stress?
I role model that. And they know this is what I believe. They know how it makes them feel. And that in turn, and I think is an encouragement for them to make sure that their team feels the same. When they are treated with respect and appreciation for the work that they do, they then in turn treat their teams the same and expecting the same performance from their teams. So it's a trickle down effect.
And as you do that, do you think that your modeling is also being noticed by other departments, your colleagues in medicine, in rehab, in dietary? Is there a trickle down effect across the organization?
Maybe a splash to the side.
That's good though.
I think so. I think that, yes, I do. Because whenever I have the opportunity to talk about the relationships that we've built in nursing and the impact that it has on patient care, I take advantage of it. And when I talk about that, I think that my colleagues want to replicate that with their teams because they see what we've been able to achieve in nursing from the relationships that we've built. So, yes, I do think that it has a splashing effect. I do think that it does have a ripple effect on my colleagues and their teams as well. Yeah.
So there are continual in healthcare, you can control some things, some stressors you can't control. How do you navigate the ongoing acute moments of stress, situations that you can't control so that you are consistent in how you show up?
So that's been a struggle. And I think it's fair to say that I've leaned on you from time to time to help me with that. What I've learned, and honestly, I've learned a lot in probably over the last year or 18 months. I've always considered myself to be very self aware, but that self awareness has grown over the last 18 months as I've been challenged.
Hmm.
Um, I've learned to breathe, set aside time to breathe and calm myself.
Yes.
I've also set aside time to quiet the noise in my head, that judge that sometimes creeps in. And I've also been able to support my team differently by being more self-aware and sharing some of the calming techniques that I've learned over the last 18 months with them. And I've seen that being able to support them differently based on what I've learned about myself and what I've learned about my own calming techniques, I've seen that impact my team differently. The way that I connect with them, the way that I come across with them, I'm always surprised at how they feed off of my mood. Even my opinions matter so much to them that they will mimic from time to time.
So
It
you're really
carries
leading
a
with
lot of weight.
influence.
Yes, it carries a lot of weight. And so I have to take that very, very seriously. So being positive about my relationships throughout the hospital, it matters. It matters so much how I show up.
So is that stressful? Is that an additional stressor as well as I think you can feel have pride in that, but does it also create additional stress for you?
I wouldn't consider that additional stress. I'm more proud of it that they trust me enough and they hold me in such high regard that my opinion matters that much.
Wow. And you feel you grew to that over your 20 years of experience.
Yeah.
As I'm hearing you. And so I hope that that is inspiring and encouraging to our listeners that you do grow. And I love how you said in the last 18 months, you even made kind of an additional pivot in your approach to leadership. And I appreciate your sharing that. You mentioned you taking more time to breathe and care for yourself as a way to manage stress. So I often have a saying that self-care is the new healthcare.
Ah,
So in caring for yourself, how do you set boundaries? Because your team has access to you by email. I'm sure they're texting you. So how do you set boundaries so that you can develop the other aspects of your life, family, exercise, all those other things you might like to do?
well, admittingly that I'm not so great at. I'm not so great at boundary management. Um, I I think servant leadership is overused, but my team is so important to me. And I don't have a lot of boundaries where they're concerned as far as access goes. And this is a 24/7 operation. And there are a lot of decisions that need to be made 24/7. And I know that you don't necessarily agree with this, and you've encouraged me over the years to set more boundaries. And but I think the role that I have accepted doesn't always allow for strict boundary management, and I know I need to work on it. I will tell you that what I have done is maybe on Saturdays, and I've done much better on Sundays, is set aside time to do things that I have scheduled, and I'll put my phone down maybe for 8 hours. And
Okay.
I won't check the email. And I spend time doing something that I love for 2 days.
I love that. I love that.
I have started doing that more.
That's great. But I appreciate that you said that the role that you are in does have a need for your ability to respond 24/7. And I think that's an honest overview of the role. And the aspiring leaders or leaders who are in that role have to consider, is this something that I want to do or that I can continue to do? And
Yeah.
you, child, as an adult child, do have that choice without other things really weighing on you. But listeners hopefully will evaluate their life and determine when they are ready or if they want to continue in a role that does have that kind of demand. That's really honest.
Yeah. Yeah. So, funny story, if I can lighten the mood
Oh,
some.
yes.
So, when I was in nursing school, everything was crazy, crazy. You know how it is in nursing
Oh,
school.
yes.
And so I thought when I started nursing, I'm going to be really bored. Yeah, not at all. It was crazy, crazy. And so on, all the way up to what I'm doing right now. And I realized that I don't like boring. I
Mhm.
can't do boring. And I was had an update with my boss, my one up this week, and we talked about working at the large quaternary hospital and in comparison to other places that we've worked, and said that it was much quieter when I worked at the community hospital in St. Louis, and wouldn't it be nice to go back there? And we both decided, no,
No,
we like this.
it's
We
your
like this.
DNA, right? It's fit
Yes,
for your DNA.
we like this. There's part of me that likes the controlled chaos. I like not knowing what's going to happen in 1 minute.
Well, and so you have had enough time and reflection, evaluation to say, yeah, this is good for me. This works, right? And I think everyone needs to have that epiphany for what really works for them, so that they enjoy it while they are navigating boundaries and answering those calls 24/7.
Yes.
I love it. So as we begin to close, what would be your code for calm for our listeners today? What would you want leaders to take away with them?
I would want leaders to take away, schedule some time at least once or twice a day to breathe or meditate. So I talked about changes that I've made over the last 18 months, and that is one of them, which is every morning I have a routine. When I get to work, before I log on my computer, I sit here, I close my door, and I breathe because I don't know what the day is going to bring, and I want to prepare myself. And in the evening, before I go to bed, I meditate for at least 5 minutes to prepare myself for sleep because my
Mm,
brain is going 100 miles an hour and it's hard to shut it off.
mm-hmm.
So that would be my code for calm. There's not a lot of time during the day to shut it off. So take the time that you have in the morning and in the evening to shut your brain off.
I
Calm.
love that. I love that. Thank you. Keeley Hayes, you all have heard some rich nuggets today on Cold Calm that I am confident will help you navigate your stress more effectively so that you live better and stay calm. Keeley Hayes, thank you so much for being a guest today. And would you be open if our listeners connected with you via LinkedIn?
Of course, I would be really pleased if they were to connect with me on LinkedIn, Melanie. Dr. Gray.
Well, awesome. I will put that link in the show notes. Everyone, if this episode of Code Calm was valuable to you, please follow and like us. And remember to live well and stay healthy. Make it a blessed day.